Dear friend, welcome back. This is our Q&A section, and the discussion today was happiness versus pleasure versus happiness, dopamine versus serotonin. And I would appreciate if the questions are related to the subject. I will go through the questions, but I want you to understand that our brain and body work together. So if I have a problem in my body, it will affect my brain. It can affect my depression. One of those are hormones in the body. Remember, cortisol is released from adrenal gland in the body, but comes to our brain and hijacks this prefrontal cortex and gets the CEO out of the picture. So now I would act like an animal, right? Whatever my midbrain says, whatever I am feeling, I'm feeling like hitting somebody or killing somebody or doing drugs. You know, we don't use our reason, logic, thinking. Same thing with other hormones. Remember, both are affecting each other, brain and body. If I have low testosterone, a lot of patients with low T are very depressed. And no matter how much you talk to them or do talk therapy or give even antidepressant, you need to address the body. So it's very important that whenever we have issues, even addiction, a lot of time people that gets to addiction, they have underlying mental disorder, you know, that is not diagnosed, like bipolar disorder, that absolutely they have some problem in the brain salt and they get into drugs. And the drug of choice for a bipolar brain is always alcohol because it calms it down. So, as somebody has written again about the high hemoglobin, basically it's called polycythemia, and they have diabetes, they have high blood pressure, and they have very low testosterone, and they have no happiness in my life, although I'm trying to help others. Again, this is for this friend that we are a combination of body and mind, and body has to be very healthy in order for mind to operate its best. If body, just one simple, I told you, one simple problem in the body hijacks the prefrontal cortex or brain, then what are we going to do? There is nothing left, you know? So a lot of time when we have elevated hemoglobin, it's in my practice been sleep apnea. And it has to, we need to find a reason for it. So if somebody has that problem, the first thing I do, I send them for a sleep study to see if that's the case. And then blood pressure is another story. We treat the blood pressure. Diabetes is another story. We treat diabetes, and it takes time. We have to work for it. Of course, we will go down. You know, these are termites of our body. Diabetes, low testosterone. And you can see how low it is, go to an endocrine doctor and get some treatment, because a low T body usually gains lots of weight, has problem with concentration, and etc. Next friend has written, it was an amazing presentation. Thanks a million. I experience a true happiness listening to your lecture. Thank you. Thank you so much. Next friend has written, I'm 65-year-old. They have written, you mentioned that serotonin is inhibitory. How do you compare the effect of serotonin with inhibitory drugs like morphine, SSRI? I mean, who said that these are inhibitory? Where did you get that information from? SSRI just increase the serotonin. You know, serotonin is released, stays in the synapses, that means the space between two nerve cells. Whatever it's used, that means whatever is attached to the next cell receptor, fine. Whatever is remaining, it has to be taken back to the cell, to the home. Okay, there are reuptake at this end. Let's say that you are in a house, 50 people go out to help a neighbor or do something. Neighbor takes 20 of them, then the other 30 will come back inside the house, right? And that's called, there is a function here, it's called reuptake, come back to the house. SSRI is called selective serotonin reuptake inhibitor. Has nothing to do with the next cell. Has the effect, you know, when serotonin attaches to the receptor at the next nerve cell, neuron, has an inhibitory. But the drugs we give to people has an inhibitory effect on the reuptake. That means whoever is on the street stays on the street. Nobody can come in. That's what SSRI works. And in a long run, not very effective. Because if I don't have enough supply of serotonin, if I don't make enough serotonin, and I spend all these serotonins in my synapse, who is going to take care of tomorrow and tomorrow after that and day after that? Because when these serotonins are coming back inside the cell, they will be reused. So that's the inhibitory at this side, okay? Gerdi Gerdunis, any inhibitory doesn't mean inhibitory. And morphine, I mean, morphine has an inhibitory effect on the breathing center. It can knock it out. Doesn't mean it has an inhibitory effect on the next neuron or nerve cell. The exact opposite. All these drugs increase dopamine in your synapse. So I don't see. And then this lecture will be put on YouTube under Dr. Minu Basari, MD. I know if you go there, most of the lectures, almost all the lectures are in Farsi. Be patient. As we go, we will add more and more English to help you in this life. All right, I think we don't have enough questions, and that's fine. I will, unless somebody else has a question in the group that would like to say it, I can say goodbye to you friends till next week. Any question in the Zoom group?
Dear friends, if you have any questions, you can put it in chat, or if you go to her YouTube channel, you can always, during the week, send your questions to her, or to our dear Paribash. She has all of her information at the beginning of the chat. On Telegram, WhatsApp, if you just send your information to her phone on WhatsApp, she'll be able to put you in the program, in the group, and forward you all the information during the week. If no further questions from all of us.
Yes,
sure.
If you don't mind, I just wanted to say one very important thing that is so crucial to understand. Look, dear friends, I'm explaining to you how the brain is functioning, what serotonin does, what dopamine does, what is the effect on the next nerve cells, right? That's to understand the basic of the brain. But a lot of time, if we don't have the supplements, if we don't have the vitamins that is needed to make the serotonin or to make it dopamine, we don't even have a discussion. You know what I mean? If I don't absorb B12 properly from my GI tract, I have problem with production of these neurotransmitters. So a sound brain starts with a healthy body. It's very important to understand that part. You need to take care of this body. And then the next step would be, eating good, taking supplement, make sure your hormones are within levels, because they affect directly, they affect your brain. When I'm talking about serotonin and dopamine, means a healthy body that doesn't have any other concerns or issues. But if your body has problem like cortisol, like the other thing that is so important to understand, a lot of time we have low testosterone because of very high cortisol. When cortisol is high in the bloodstream, everything else has to go low. And they go low. They go low. And the first hormone that usually goes low, that's not enough of it, is thyroid. And then, of course, the other hormones. So always find the reason for things. Nothing happens without a reason. When blood count, back to that friend's question, when you have elevated red blood cells, find out what the reason is. Why is it high? Is it the bone marrow that is making too much? Is it you smoke? Smoking can cause that. Is it sleep apnea? Number one cause, my book would be that. Find out what the reason is. Not just that I have this and this and this, and I'm not happy and I don't know what to do. Nobody can tell you what to do. You need to find like a detective. But calming down the brain always helps, even if the body is sick. And calming down the body is good for the brain. And the best time, the best way to help your brain is make sure you have a deep, deep, deep sleep. Stages 1, 2, 3, only in stage 3, brain will clean up the house. Only in stage 3. Nothing will be done if you don't get there. And all the trash in the brain will be piled up, piled up, piled up, piled up. So, and by exercise, you increase the blood flow to the brain, and that way help clearing the system. Because look at your house. you have trash. One day a week, somebody comes to pick up your trash. Same thing in our brain, in our heart, everywhere. The pickup time for trash in our body is during the deep sleep. You don't have that, that means your organs are packed, piled up with junk, with trash, and you will see the consequences. The consequences. And again, back to that friend that says high hemoglobin, high blood pressure, diabetes, and low testosterone. First thing I would tell this friend is get a sleep study. Because when I have obstructive sleep apnea, A, my blood pressure goes up. B, my cortisol goes up. C, when cortisol goes up, sugar in the bloodstream has to go up. That's the order of cortisol. And I'm prone to diabetes because whatever cortisol goes and breaks down the muscle, makes it sugar. D, my blood count, my red blood cells has to increase because the message was sent to the bone marrow that the organs are not getting oxygen. Increase the carriers for oxygen, which are red blood cells. So you see the picture, and no matter how much I tell you guys, so many of us don't even listen. And not listening and make that choice to not take an advice in has a consequences. Like any choices we make in this life will have a consequence. That's the story of our lives. Pay attention instead of bringing this problem up every week that we have a Zoom. Act on it. Do something about it. Read about it. Listen to what I said one more time. And go and get your sleep study done, please. All right, my friend. Till next week, have a wonderful, wonderful life. Thank you and wish you the best. Wish you health, wish you happiness, and wish you service. And I would like to say happy Ayyameha to all friends around the world. And till next week, God be with you. Thank you.